A blame game has been triggered by Brisbane's snap 3-day lockdown. Queensland has taken a swipe at the federal government for a slower than expected start to the national COVID vaccine rollout. The Health Minister, Greg Hunt, has hit back, accusing the Sunshine State of having a large inventory of jabs it's able to use. He says of 106,000 available doses, the state has administered 59,000, so half, roughly. It's now facing questions whether a speedier rollout could have prevented the state's new virus cluster. Well, let's bring in Dr. Chris Moy now from the Australian Medical Association. Doctor, thanks for your time. So, makes a point. Greg Hunt makes a point.
Look, I think that there are issues about the rollout in Brisbane and ensuring first up that it happened in that sort of Group 1A, the frontline staff, as quickly as possible, but particularly the staff that are most likely to be exposed. And I think the concern has been that, the one doctor who might have been working with individuals who are COVID positive, I gather, was not vaccinated. I think the other concern has been the ongoing issues with the level of personal protection equipment. And so the AMA's had concerns about both those aspects. But look, the bottom line, it's the cat's out of the bag at the moment. We've got a problem. We've got to close it down because we've got to take this medicine before winter, because otherwise you might, just when we thought we had this under control, we might be winning this game, we might lose it. So we've got to control it now.
So what could be reasonable excuses for those delays, Doctor? As I mentioned there, only about half of them have been used, according to the Federal Health Minister.
Well, I don't know exactly why. It hasn't gone to the staff yet. And I mean, certainly some are being held back because they're being held back for second doses. But the main thing is that the doses are first up used as quickly as possible in those frontline staff. It's 1A. I mean, this was the critical group really to some degree, because they're the front-facing staff and of both doctors and hotel quarantine staff were the most likely to get exposed. And really it was a matter of getting it out there, but particularly getting it to the ones that are most likely to be exposed. We don't need necessarily somebody who's a backroom person. We need the person who's actually seeing those individuals who actually have COVID. So choosing those and why certain ones didn't have it by that stage is going to be questions, and we've got to look at it. But having said that, I think there's a big issue now of just closing it down now. It's happened. Sometimes you just have to close it down and then look at all that afterwards.
What do you make of the entire state having to wear a mask? So you've got this tiny outbreak in Brisbane, and there has been another case in Gladstone. This is why the Premier's decided this. But what does that mean for someone in, say, Mount Isa?
Look, I think the problem is that, when the first case came out last week, they kind of were trying to really grapple with exactly how far this was gone and whether there was just a lucky a small group of people linked to something that earlier on, or whether this was the tip of the iceberg. The problem is as the days have gone on, what they're finding is that the joining the dots, the case contact tracing is revealing extra cases that they can't link back. And so they're really worried that the combination of, summer and relaxation and maybe reduction in testing, and everybody's relaxed, everybody's been out and about, they haven't got tested when they've got symptoms, and it's actually much bigger than they think. So in fact, it may not just be in Brisbane, it's actually wider than that.
And Easter's coming.
Byron. And that's the scary bit. I mean, when people get together. And so unfortunately, it's really sad, particularly that it's coming into Easter, but taking this medicine is really important for Queensland, but also for the rest of Australia at the moment. Yeah. I know it seems hard, but we don't want to lose the unlosable game that we seem to have had under control until now.
Yeah, and the Premier has been, largely supported, particularly in that last election win, by her state. So what she's done up until this point has been proven correct.
Yeah, and I think this decision is right. People might wonder why, we've got the vaccine rolling out. Well, the vaccine rollout hasn't happened to enough of the community. It isn't safe yet. And I think the lesson that has been learned, I spoke to some people who are really depressed in Germany at the moment, some of our friends who have just been really, I just could see how much desperation they have at the moment. Every 2 or 3 weeks they go into lockdown. I think people have to remember what happened in the UK and Europe when they just relaxed over summer and they kind of thought they had it under control.
Yeah.
And it was exactly that actually caused the problems, because the cases were not under control and it went completely bunter once winter hit. And we've got to first up close it down, make sure those cases are out there, and then get that vaccine out there, because it's going to be a lot easier without the cases out there.
Okay, Chris Moy, thanks for your time as always. Talk to you soon.
It's a pleasure.